We're going to, primary concern in the shoulders is what internal rotation of the arms, and you'll see people, and you'll see the backs of their hands as they're walking along. In a neutral position, the thumbs would be forward. So we want to stretch out the pec muscles that are associated with that by palms forward, and we'll relax, and take the arms back like so. Now you can facilitate this on your own utilizing a doorway, and all you have to do is put your arms into the doorway here and walk yourself forward and allow that stretch to occur. You can do one arm at a time or two simultaneously. We want to look at the shoulder and neck muscles, so we would then start to do some arm circles. Okay? And we want to make full ranges of motion, and you want to go both in clockwise and counterclockwise because you'll have better ranges of motion from one way to the other. This is a good way to do this on your own is do it next to a wall, and it will force the arm to really stretch, and you can use the wall to crawl your fingers around and get a greater stretch to the shoulder girdle itself. The last thing we want to look at is the neck, and the neck can move in all three planes. We first want to deal with lateral flexion. She's going to take one hand and reach over across her head. You can do this seated in a chair, and this arm would be fixed to the bottom of the chair, and all she's doing is lengthening the ear from the shoulder as far as possible. So you just want to think, make this part as far apart as possible. And of course we're going to go one way. We're also going to go to the other direction. So that is lateral flexion of the neck. The other two primary motions would be flexion and extension. So you can just seated in a chair, you just look up at the ceiling and allow the neck to stretch in that regard. And then you can look all the way down and reach back and grab the back of your head, not forcing anything, but just kind of putting some gentle pressure, and you'll feel the back of the neck down in between the shoulders stretching to lengthen these muscle tissues out. The last aspect would be rotation, and all you have to do is look one way, and then just take your hand and just give a little extra force. Again, not forcing anything, but just a little added pressure to feel that end range of motion. This is resensitizing the body to the way motions are supposed to feel. And that's the way aberrant motion then comes back and becomes a normal functional ranges of motion. So that's a basic, took us just a few minutes to run through. There's no gym equipment required, nothing that you have to do in a very small window of time. Very effectively manage most musculoskeletal conditions that people deal with. And as the show progresses, we will get more specific and put in a few more things. And this information we're also doing at Reardon Hall Tuesday mornings, 8 a.m. It's free to POA members in one of the rooms in the back. It's called the Back to Health class, and we do that for the community as well. So thank you very much. So today we have discussed degenerative disc disease, degenerative joint disease, and the fundamental biomechanics that are associated with pain patterns. We've discussed mechanism to injury, how to manage these conditions without side effects and without actually having to go to any gym or anything like that. On future episodes, we're going to be discussing such topics as TMJ dysfunction, fibromyalgia, shoulder issues and rotator cuff issues, as well as back pain, neck pain, headaches, and things like that, and many other topics that will still to come. We invite you to call in or write if you have any health questions, whether or not you think it's a chiropractic problem or not. Part of my commitment to the community is being an information source and being able to provide complex topics in a simple way to allow people to understand things at a deeper level that makes the entire community a more healthy place to live. And if you are going to call or write in, our office number is 876-5500. Feel free to call in if you have any questions, or you can write to us at Lifetime Wellness, 701 Northwest McNelly Road, Suite 9. That is in Bentonville. That's just up from the Walgreens, and the zip code is 72712. Today we do have one question that comes from Diane of Bella Vista, and she asks, I've been diagnosed with fibromyalgia, and I've been looking at information, but I don't understand what it really means. Can you explain it? Fibromyalgia is a conditional diagnosis, and it's specifically to this systemic muscle tension and pain, and there has to be a culmination of specific points throughout the body where there's pain and tenderness upon touch. If you have the required number of these points present, then you are therefore diagnosed with fibromyalgia. Why does it occur? No one is specifically clear in understanding. Basic mechanical understanding and my thoughts are that this is a mechanical neurological disorder, and you have, it's like short-circuiting in a wiring mechanism. The body's inability to relax these muscles, so they constantly are staying in this hypersensitive state. And over time, this becomes a very debilitating condition. And however, it is very well managed through chiropractic care. I would like to thank the Bella Vista Community Television for allowing us to do this. I appreciate everyone, and I look forward to taking care of your health in the future. Thank you.